I'm going to try to give you a little bit more with the message that I would like to deliver today about diet and nutrition. This is my disclosure, but actually my real disclosure is this one. So I don't have anything to do with these nuts. I know it's not very, let's say, very appalling to be associated with nuts, but these are, one patient, I was at Roswell Park, and one patient came one day, and he brought me this jar with these nuts, and there was my name on it. I say, and apparently they're very good. I tasted, and they're very nutritious. It's a volcanic area in the Philippines. So anyway, so this is what we'd like to do again on the next few slides, to discuss how diet and nutrition may have an impact on patients with cancer, and also with kidney cancer, of course, and tell you a little bit, just a little bit, about our project to use a diet, in particular diet protein restriction, to stimulate the immune system. I'm sorry. Let me get it right. Okay, good. So this study has been actually updated at our ASCO meeting in Chicago, the annual meeting on oncology. And I think you heard probably some headlines on radios and maybe on TV. Now there are strong evidence that diet has impact on cancer. This is a large study called the Women Health Initiative. So thousands of women that were followed up through the years, and they did some diet and intervention, and they saw that if the women were adopting a low-fat diet, they have a less mortality. So they live longer, eating less fat, and they have a less breast cancer, and diet less of breast cancer, and also other disease, other cancers, as a matter of fact. So now we have evidence that diet really matters, not just the common sense. So there are guidelines out there. This is one of them. These are from the USDA. You can download it from the website. This is I had Rachel Bordogna, is a very talented registered dietitian, research nutrition from Purdue, who has been working with me. Beth Kircher, we have a dietitian in the clinic, and been providing me some of this material. But some of the key messages from these guidelines is to try to make some change in your diet. And the best way to do it is to do it by small change. This is an example. Of course, everything you eat or you drink eventually will have an impact on your well-being. But try to come up with a plan to make. Sometimes, again, you heard about Mart and Rachel. They became vegan, and I think that was a pretty maybe sudden change without doing it on a stepwise approach. This is a long list. I don't expect you to read it, but there are some recommendations. Again, you're going to see it also in that guidelines. You can download it, and you're going to have access to these slides. But there are some, I would say, now became common sense, common guidelines for healthy lifestyle. For example, achieve and maintain a healthy weight throughout the life. So, and actually, we need to teach our kids. We need to start with our kids that keeping their weight down is important by doing more physical activity, and of course controlling what they're eating. Adopting a physical active lifestyle, we still do not do enough exercise like we should. And one recommendation is consume more plant food based diet. So the notion that animal protein perhaps may not be as healthy as we believe probably is true. and drink alcohol in moderately. Again, we know there is strong, think about, for example, breast cancer. There is a strong link between alcohol consumption and cancer. I'm going to tell you in the next few slides, we're opening a clinic. It's called Snack Clinic without the K. It's based on Science, Nutrition, and Cancer Clinic. And Beth Kirsch and Rachel Bordogna will be part of this. And the goal is really to have a dietitian work with our patient, not just kidney cancer patient, but all patient in IUSM Cancer Center, to try to identify some goals in terms of nutrition and go through that. Identify risk of malnutrition. Sometimes a patient go through this risk of malnutrition. Losing weight is because of the cancer, because of the side effect of the therapies, and how we can deal with that. And this is just some food for thoughts, but of course, cancer diet should be tailored based on the goals that we have, the treatment the patient is receiving, the current side effect that the patient is experiencing, and whether or not appetite, the lack of appetite is an issue. And in general, goals are weight maintenance. If a patient actually is losing weight, how we can help patient not to losing weight. If a patient actually gaining weight, think about patient with prostate cancer, get hormonal therapy, how we can help them not to gain weight. Hydration, as you know, drinking fluids and water is very important. Is as important as a healthy diet. You can have the healthiest diet you have, even if you do fasting. You know, there is this 1688 schedule. Now there's an app that tells you when to fast. You still need to drink a lot of water. That's very important. And again, I think this treatment, this nutrition-related treatment breaks is also an issue I want to address later on. Malnutrition, again, we do see that with other disease rather than probably kidney cancer, although some patients with kidney cancer, especially at the end stage, may have this important feature. But therefore, we know that if patient is malnourished, losing weight, we know this patient may have less life expectancy. So addressing that is very important. And losing weight, this is some of the characteristic. Patients are feeling tired, not just one day, but it's at least 5 days a week. Losing 1 or 2% over 1 week. The patient in general loses the subcutaneous fat and also the muscle. And overall, they are less functional. We still do not know why patients get malnourished. This concept of cachexia that maybe you have heard. Again, there are some tumor type that we see more, for example, pancreatic cancer. But one of the potential culprit for this malnourished status of this patient is inflammation. And again, as even a physician, I still do not, I'm not able to give you really a very clear definition of inflammation. So if we are not clear, I'm not sure whether the patient can be clear on this. But there is something that's been kind of accepted in some definition. But inflammation is really a status in our body where the immune response is disorganized. Again, you heard very elegantly from Dr. Logan, Dr. Adra, how our immune system tries to fight cancer. But this concept of inflammation, we believe that impact our well-being. And if you are a cancer patient, your capability to have a good response to immunotherapy. And nowadays that immunotherapy is so important, of course, we want to decrease the inflammation. There are a lot of research to try to find the pill that fight inflammation. I don't think it will ever have that pill that fight inflammation. There are going to be probably some immunotherapy drug that will target the inflammation, try to reorganize the immune system. But I believe, strongly believe, that diet can regulate inflammation in our body. And this probably is not a new concept to all of you. But now it's been associated, again, and anti-inflammatory eating might be associated with reduced risk of cancer, but also other chronic disease. Joint pain. Patients that have rheumatoid arthritis, we know that depending on the food that they're eating, they might have more or less pain. Again, we still do not know exactly the link between food and inflammation, but there is some strong evidence that processed food, excess meat, especially red meat and saturated fat, indeed can induce inflammation, this disorganized status of immune response. So common sense would be to try avoid this processed food. And by doing so, increase the plant-based food that may have an anti-inflammatory activity. Vitamins, minerals, fibers, and this we call it phytochemicals, perhaps may, again, have an impact on our immune system. So the more colorful your plate is, the healthier it is. You know the notion. If you have red, green, yellow in your plates, that's what you teach. We teach that to our kids. But it's true. The more color we see in your plates, probably the healthier. Unless they're artificial color, that doesn't count. So again, eat more vegetable and fruits. That is really the common sense, but I think there is now scientific value on that, and really, I mean, this recommendation, I think, filling half of your plates with vegetable fruits, I think it makes sense. Whatever you're eating, even if you're eating fish and poultry, and maybe red meat once in a while, in your plate should have also vegetable, probably not fruits. I don't like to eat fruits, so but you know, there are some fruits that actually goes with fish. Again, changing the think about meat sometimes, that can be helpful to use as a garnish, not as your main meal, even if you think about, you know, eating meat. Recommendation perhaps less than 18 ounces per week, but I would say not just, yes, that would be the minimum, I would say, for red meat. And use beans as a protein source. The beans are different. Yes. Yes. Absolutely. Absolutely. You can still keep playing around. I'm not asking to become vegan or totally vegetarian. I probably am not able to do that. And we have some experiments showing that actually perhaps fish and poultry are actually, they don't have the same detrimental effect on the immune system like casein. We work primarily on casein, the milk protein. Yes? That's very true, yeah. So increase plant-based eating. So you can find proteins in beans and seeds and nuts. They don't need to be pili nuts, but there are a lot of nuts out there. They are good source of minerals, good source of fibers, and healthy fats. You know, there are bad fats and good fats, healthy fats. Seafood, I think, of course, if you're not eating red meat, let's eat more fish. Salmon, there is a mercury in salmon. I don't know, but I think a fish, seafood, if you don't have a high cholesterol, I think is a good alternative choice. Again, there are also evidence that the cooking oil may be important, or the oil that you put in your dressing. Again, not because I'm from Italy, but extra virgin oil, olive oil, of course, is a good source. But also avocados oil. My wife is starting using avocados oil. I didn't even know that you can squeeze oil from avocados, and they're actually more expensive than extra virgin Italian olive oil, believe it or not. So plant-based eating, whole grains, as you heard, probably. So if you can find whole grains in the label, that's probably what is recommended. And the label may have this whole wheat. These are, again, less processed material, contain more fibers, have vitamins and minerals. They are complex carbohydrates, so they're good carbohydrates, and they have a high phytochemical. So you can, look for this label. One thing that we tend to, for example, in my household, to switch from white rice to brown rice. That's one way to do it. That contains more whole grain. Avoid sugar. This is a common sense. Let me tell you, I think we wrote actually in a research article, our experiment where we dropped the protein in the diet, we don't see really a detrimental effect, meaning that this notion that, when patient tells me, but I think a sugar feeds my cancer, I'm not sure if that's true. And as you know, ketogenic diet is a very on fashion right now, where you completely abolish pretty much the simple carbohydrates, but you increase the fat. And perhaps also the protein. So again, there's still a lot of debate, but in general, as a general health message, decreasing the simple and processed sugar is always a good idea as a healthy lifestyle. This again, the Harvard plate, very similar to a recommendation that I already mentioned to you. Increase in fruit and vegetables, use of whole grains, healthy protein, primarily plant-based protein. And stay active. I mean, this is exercise and nutrition that goes hand in hand. So this is called a Mediterranean diet pyramid, because the Mediterranean diet that is been also implemented here in the United States is perhaps the closest that we think it might be to a healthy life diet intervention. And so on the top is things that you should try to avoid, and the bottom will really think that they should be part of your daily nutrition. And I think this is something that I believe we should teach to kids in the school, that we don't do a good job to do that. So this is my take-home message. We're still learning about inflammation, but inflammation is a major challenge in patients with cancer, and particularly I believe in patients with kidney cancer. So how we can reduce that? I think to me the diet is one way to attempt to do that. We know that the diet have an effect on the bacteria in your gut, and you probably heard that we have billions of bacteria in the gut, and there are good bacteria and bad bacteria. And the good bacteria are the ones that are gone with antibiotics. So patient with kidney cancer there in my clinic, we always concerned about using antibiotics when you're on immunotherapy, because now there are definitely data showing that if you use antibiotics, even for a short period of time, you might not respond as well to immunotherapy. So if you need to get antibiotics, you got to have antibiotics. But the diet also is a way to affect the bacteria in the gut and to affect the inflammation. Supplements. I think I support the idea to use vitamin D and vitamin C, because there are evidence these vitamins definitely have effect on immune system. I know Dr. Adler is a believer of, I think it's zinc on immune system, maybe selenium. But I think you can get this, of course, also in fruit and vegetables, so you don't necessarily have a supplementation. And integrating, of course, dietary change with regular activity, physical activity is important. I mentioned that diet affects the gut bacteria. We're trying to actually study this in our diet intervention and clinical trials. And for patients with kidney cancer, we're now starting a process. We're still working on it, but again, Dr. Adler, Dr. Logan are also involved in this to try to isolate this tumor at the time of the surgery and try to learn more about the biology of this tumor. In the future, we're going to actually do some diet intervention in the mice who have tumor taken from specific patient and to see whether that specific diet may actually have an effect on that specific tumor. This is a data we just published last year. This is a mice, but this is a survival curve by Dr. Logan and Dr. Adler showing all the survival curves in human patients. These are mice. They're little patients. But what we did, we decreased the protein content in the diet. From 20%, 21% is the regular protein content to 7%. By doing so, we saw these mice, if we have a low protein diet and have a agent like a nivolumab, they live much longer. And we discovered that we affected the immune system. So we want to actually do this eventually in patient. We're opening this neck clinic on July, I believe July 1st. July 1st. And it's going to open to any patient. But what we're going to do with Rachel Bordogna, we're going to see this patient on a routine basis, and we're going to do diet assessment and try to come up with some diet intervention. We're going to collect some blood, some stool. But that's my goal, is really to have dietitian as a personal trainer. You think about personal training just for exercise. I think the dietitian should be a personal trainer to every patient with cancer. Unfortunately, we don't have the resources right now. The challenge is that the insurance does not cover dietitian. So right now, I need to pay for the salary of the dietitian in the clinic. But this is the overall dream that I have, to have a place where patients come, learn how to cook, maybe get the meals prepared, sometimes during the time of treatment, but do exercise, do meditation, mindful program is very important as psychological support, and that sometimes get also the infusion in the same place and the same structure. So that's really what I want to tell you today. I think there is a unmet need to integrate nutritional intervention in patient with kidney cancer. We're only at the beginning, but we try to eventually find out which diet may be more appropriate to a specific tumor, to a specific patient, in the setting of a specific treatment. And really we want to improve the quality of life. And at the end, we want to establish this chapter of the Junior Nicholson Foundation here. I want to tell Mark that actually, why you say why we don't get together. I will support every 3 months get together for a little dinner, either you or somewhere, and I'll get the foundation involved. It's just a way to get together. I promise every 3 months from now we'll start it, and we'll get together. No steak, no steakhouse. Sorry. Bye. You want to say it? No?
Oh, no,
Okay.
I mean, actually, to add on your nutrition thing.
Yes.
One thing, there's some very good spices as far as that are anti-inflammatory. Turmeric, in
Yes,
particular,
that's true.
comes strong,
That's very true.
and ginger as well.
That's very true.
Turmeric really, compared to anything, it doesn't
That's very
change
true.
your whole
Thank you.
taste and all
Yeah.
that. And then I would also stay away from farm-raised fish.
I don't have much time to go a clinical trial. I think this is this still working? Yeah. I think we run out the battery. I don't know if it's got, yeah. This, this one? Yeah, maybe.
I think we may have a second one.
Okay, but I think you can hear me.
Oh, yeah, here we go.
Perfect. I think it's.
There you go.
That's
That one's
perfect.
green.
Thank you very much, Gary. Looks like you're working here. So I'm not going to have time to talk about the clinical trials. Dr. Adler already gave you a very nice overview what phase 1, phase 2, phase 3 means. Susan, Gary give you a beautiful presentation about clinical trial participation. I want to just give you a snapshot of the study that we're doing here. This is the only slides I want to present you. But so we do have a study for localized disease. This is a throughout the nation, and a patient who have disease in the kidney, they're randomized either to surgery or to nivolumab, so immunotherapy for a couple cycle, do surgery, and then do some more immunotherapy to see whether immunotherapy early on can help. And this is really led by Dr. Adra at our institution. When the patient unfortunately develop disease, we have standard care. Of course, we have all the pills and the immunotherapy Dr. Logan and Dr. Adler already mentioned to you. We do have some clinical trials, and Susan, actually, thank you for pointing out that we have a study with high-dose interleukin-2 and entinostat. Some of you actually have been participate to this study. And it's a way to make the immune system stronger. We use the same agent, these are histone deacetylase inhibitors, in combination not only with high-dose interleukin-2, but for example with, again, immunotherapy, atezolizumab, anti-VEGF, anti-angiogenics. These are in first line, or now we amended the protocol for high-dose interleukin-2 is going to be also in second line. So patient has prior immunotherapy, we're going to be able hopefully to offer this. We have completed this study, so we just presented the data at ASCO with another histone deacetylase inhibitors plus pembrolizumab. And we're offering these studies that also Susan mentioned, where we combine immunotherapy, again with this histone deacetylase inhibitor, try to boost the immune system. We are working on bringing a study based on our preclinical data and targeting the androgen receptor in kidney cancer with this combination. So that's really want to mention. Again, clinical trial participation is very important. We might not have all the clinical trials you may need. So as you know, Dr. Logan, Dr. Adler, myself, we always encouraged to look also other options. Chicago is not very far away if there is anything that you need, but I encourage always a patient to have a very open discussion with the treating physician and to find when the time comes, as Susan and Gary says, for the clinical trial, where is the best option. So thank you again for your attention.